First, the environment is prepared in order to be able to perform a physical examination. The examiner positions the examination couch appropriately for the intended examination and ensures that fresh paper is covering the couch. It is important to ensure that the examination area is quiet and private, and any curtains or blinds are closed. All necessary equipment and materials required to perform the physical examination should be assembled. These may include, for example, a stethoscope, pen torch, or non-sterile gloves. In the hospital or clinic setting, patient records and observation charts should be assembled, and hand disinfectant should be available. The examiner first introduces themselves to the patient and clarifies their role. In some cultures, greetings and formalities such as shaking hands may not be commonplace, and some examinations will be inappropriate if not performed by someone of the same sex. It is important to be aware of and show respect for any cultural differences that might be present. The examiner confirms the patient's name, date of birth and, if appropriate, their hospital number. The examiner explains the intended examination to the patient using language that they will understand and avoiding medical jargon. It can be useful to ask the patient to repeat this back in order to check that they have fully understood the information. The examiner should ask the patient if they have any specific questions before proceeding. The examiner gains verbal consent from the patient to perform the specific physical examination. For certain examinations, such as internal examinations, it is best practice to document that consent has been gained explicitly. A chaperone of the same sex as the patient should be offered and provided if this is indicated. The patient should be allowed privacy to get undressed. The patient is exposed to be able to comprehensively examine the relevant body system, taking care to preserve dignity when full exposure is unnecessary. The patient is positioned as required for the examination. This may be standing, seated, or positioned on an examination couch at the appropriate angle of inclination. Specific patient positionings are described for each physical examination. The examiner then washes or disinfects their hands. Finally, the examiner asks the patient if they have any areas of pain or specific disability before commencing the physical examination.